when we talk about the pre-hospital care, most of us are very familiar with the ACT FAST algorithm, right? The Cincinnati stroke scale, which is face, arm, speech, and time. Which the thing to remember about the Cincinnati stroke scale is that it is designed to detect presence of. It doesn't do anything about severity. It just says, is the patient stroking or are they not? It's pass-fail, right? And so you look at that face. Do you see, do they have an equal smile, or do they have say a facial droop? You have them hold their arms up. Does one significantly drift? You ask them to talk. Are they able to speak clearly? Are their words muffled? Are they confused? And then time is, get that onset time. If you can look at this next one, though, this is one that we use here, which is the rapid arterial occlusion evaluation scale. And this actually detects the severity of. And if you look closely at this, at the way that this evaluation is done, it's essentially a Cincinnati stroke scale, but on steroids, right? What you're doing is you're taking the face, arm, speech, and time, and you're giving it a numerical value to associate with the severity of the presence of that sign or symptom. So for example, with facial palsy, is it absent? You don't have it. Is it mild? Like, yeah, they could potentially have some facial droop. Or is it clearly obvious, right? Like this patient has complete unilateral paralysis to the left side of the face. That would be a 2, right? 0, 1, or 2. And you go through arm, leg, motor function, all that stuff is all the same. Now, the only one that's different is the head gazer deviation. And in the presence of head gazer deviation, it's really, is it present or is it not? So you either get a 0 or a 1. And that number that you gather doing off this assessment will give you kind of the severity of the stroke, like how bad is it? And so they say, as you can see on the screen there, if the race scale is a 5 or greater, the patient probably has a large vessel occlusion. You probably have an occlusion that is in one of those more main arteries supplying blood to the brain. Whereas if the number is smaller, you may have a smaller vessel occlusion that won't result in as significant a neurological deficit. If you're unfamiliar with the race evaluation, I recommend, it's online. You can access it pretty much anywhere. Get familiar with it. It's something that's very, very beneficial to you.